At New York Presbyterian, it's an exciting time for us because we have been able to assemble a group of experts in pancreatic diseases and assemble that under the Pancreatic Center here at New York Presbyterian. Our mission is, number one, is taking excellent care of our patients in a comprehensive, compassionate, and seamless fashion. And what that means is that we've been able to put together all of the specialists that are necessary for the complete care of patients that have either benign or malignant diseases of the pancreas. These are complex problems and requires the input of a wide range of different experts in surgery, medicine, gastroenterology, medical oncology, radiology, pathology, the list goes on. And we're fortunate here to have in our departments these individuals who we've put together and assembled to take care of pancreatic diseases. So we feel very fortunate in that we have the people here to take great care of patients. Now, in this process, for instance, a patient with pancreatic cancer, it's a difficult diagnosis, it's a rigorous treatment program, and families are quite affected as well. And so we also have here the supportive services for families, such as social workers, nutritionists, and genetic counselors, all the things that come up related to the patient and their families going through these treatments for complex diseases. And so I'm very proud to represent the Pancreatic Center today and tell patients, prospective patients, about all the services that we have to offer, from diagnostic treatments such as surgery or medical treatments such as chemotherapy or radiation therapy, to also indicate that we're very active in the research and developing treatment protocols for patients who have pancreatic cancer and pancreatic diseases, and have assembled some of the very prominent basic scientists here at Weill Cornell to participate with the translation of taking research projects from the bench to the clinics. Then, of course, an important component of what we do here is education. We are a medical center. We have medical students, residents, allied professionals that are learning to help take care of patients with these diseases, and we are active in that front as well. And lastly, in terms of patient outreach, we offer a variety of seminars and education seminars here at the university. Over the course of the year, we're active with PanCan, the national organization that has interest in patients with pancreatic cancer. And so these are some of the things that we offer, and I think we offer high quality for these problems. And so I'm very proud and happy to be able to talk to people today about what we can offer when a diagnosis or a problem related to the pancreas arises. Surgery represents the main curative option for someone who has a diagnosis of pancreatic cancer. Unfortunately, not everyone is amenable or a candidate for surgery based on the stage of their disease. Some patients, and unfortunately many patients with pancreatic cancer, present late in the course of the disease and unfortunately are not a candidate for surgery because the disease has already spread to other sites or is locally invasive of blood vessels that supply organs that can't be sacrificed. And so an estimate is anywhere from about 75% of people are not candidates for surgery. That means about 25% are potential candidates for surgery. The surgery for pancreatic cancer is typically complex. It can be long operations, and the procedures should be done by people highly experienced with the procedure and in hospitals that are highly experienced in taking care of patients who have had operations for pancreatic cancer. Many studies have been done showing that the relationship of volume, both at the physician level and the hospital level, is associated with better outcomes. And we're fortunate to be a high volume provider for pancreatic surgery. The typical presentation for someone with a tumor in the head of the pancreas is painless jaundice. Those patients present many times with a tumor that can be resected, that can be removed. And so they're offered a pancreaticoduodenectomy or Whipple procedure. And what that entails, the classic Whipple, is the removal of the head of the pancreas and the uncinate portion of the pancreas, the duodenum, the end of the bile duct, the gallbladder, and in some patients, the antrum of the stomach. There's also a pylorus preserving pancreaticoduodenectomy, which preserves the very end of the stomach. Studies have not really shown a great deal of difference in terms of outcomes based on preservation of the end of the stomach or removal. So it seems in surgical terms to be a minor change in technique. Patients then therefore have 3 new connections that are made. One connection to the pancreas, one connection to the bile duct, and one connection to the end of the stomach. So the recovery from the procedure is dependent on healing of these new connection sites. So the operation has complications associated with it. And it's because of these complications that experienced centers do better, because we know how to handle these problems, because they do arise. And they can come from leaking of one of the connection sites, a bleeding complication, a problem with delayed gastric emptying. Those are the common sort of side effects of the acute surgery for pancreatic tumors in the head of the pancreas. These procedures can last from 5 to 8 hours, depending on the complexity and the relationship of the tumor to important blood vessels that run in proximity to the pancreas. That's sort of the, you think of real estate. The real estate of the pancreas is in a very tricky area. And it's because of these blood vessels that supply the gland, that are surrounding the gland, that adds to the complexity of patients who are able to have resection and trying to handle involvement of those blood vessels and remove the tumor completely, because it's the complete removal of the tumor that's essential. In this particular disease, debulking of disease, taking out 90% of the lesion, does not offer a lot of benefit, and it offers a lot of the complications that can develop with the tumor. Here at New York Presbyterian, we do a high volume of pancreaticoduodenectomies. Our morbidity or side effects are quite low. Our mortality is quite low. We're less than 1 or 2%, whereas in the past, in fact, in the late 70s or so, the mortality, the death rate from an operation such as this was as high as 20–25%. So with the advent of experienced surgeons, experienced centers taking care of problems related to the surgery, we have an extremely low mortality, which is probably one of the best in the country.